हाय एवरीवन। आज हम लोग डिस्कस करने जा रहे हैं टीबी ऑफ स्पाइन, दैट इज आल्सो नोन एज द पॉट्स डिजीज, नेम्ड आफ्टर पर सर्वाइकल पॉट. So spine is the most common site of skeletal TB, and in spine, the most affected region in ascending order, it is dorsal region, followed by lumbar, and then dorsolalumbar, and the least affected region in spine is lumbosacral. अब हम लोग इसके पैथोलॉजी को देखते हैं. तो जो स्केलेटल ट्यूबरक्लोसिस है, जो ट्यूबरक्लोसिस ऑफ स्पाइन है, दैट इज ऑलवेज सेकेंडरी, एंड बेसिलाई रीच द स्पाइन वाया हेमेटोजेनस रूट थ्रू आर्टरी और बैट्सन्स paravertebral plexus of veins. And upon reaching the spine, bacilli establish either of the four types of anatomical lesion, that is paradiscal, central, anterior, and posterior. So now we will see uh, uh, the paradiscal. The paradiscal is most common among the four types of anatomical lesion, and the contiguous area of two adjacent vertebra along the intervening disc are affected. Uh, the two contiguous area of the two adjacent vertebra and along the intervening disc is developed from the same sclerotome. So they have the same arterial supply, and when the bacilli reach there with that artery, it affects the contiguous area of two adjacent vertebra along the intervening disc. So we see that this type of pattern in paradiscal type of lesion. The second is central. When infection is spread by the intraosseous venous system, and specifically it is not Batson plexus, it is intraosseous venous system, then then we see the central type of lesion. And in central type of lesion, the concertina collapse of the vertebra happens that leads to the vertebra plana. And in anterior type of lesion, the lesion spreads along the anterior longitudinal ligament, and that give rise to the aneurysmal phenomena. And the posterior type of lesion is very rare. Now we will see the clinical feature. सबसे पहले हिस्ट्री में मोस्टली पास्ट और फैमिली हिस्ट्री ऑफ टीबी होगा. एंड इन सिम्टम्स, द अर्लीस्ट एंड मोस्ट कॉमन सिम्टम इज बैक पेन, stiffness, swelling, that is due to the cold abscess, deformity, paraparesis can be there, and mostly these all are associated with the constitutional symptoms, that are low grade fever with the evening rise of temperature, malaise, anorexia, and weight loss. Sign में paraspinal muscle spasm is the first sign of Potts spine, and the movements are painful, and kyphotic deformity uh, can be seen. This kyphotic deformity can be of three types depending upon the number of vertebra it involves. अगर एक वर्टिब्रा इन्वॉल्व हो रहा है तो इट इज नकल. अगर दो से तीन वर्टिब्रा इन्वॉल्व हो रहा है तो इट इज एंगुलर. एंड इफ द number of vertebra is more than 3, number of involved vertebra is more than 3, then it is rounded. So there is one mnemonic for this sequence, that is car, kyphoid, knuckle, angular, and rounded. So knuckle is for single vertebra, angular is for 2 to 3 vertebra, and rounded is for more than 3 vertebra. And one more important thing is cold abscess. The usual sites are sometimes in exam it is directly asked that the usual sites of cold abscess. So that's why this is important. So triangle, anterior and posterior triangles of neck is one of the site where you can find the cold abscess. Paraspinal region of back, along the brachial plexus in axilla, along the intercostal nerves in lateral or anterior chest wall. You can find cold abscess in iliac fossa, along psoas muscle, that is known as the psoas abscess, and in lumbar triangle and upper part of thigh. These are the usual sites of cold abscess. Now we will discuss the neurological complication. So causes of paraplegia in Pott's spine can be divided into extrinsic or intrinsic factor. So in extrinsic compression of cord, it is further divided into inflammatory and mechanical. In inflammatory causes, the inflammatory edema itself or granulation tissue or pus, sometimes tubercular abscess or caseous tissue, they can cause the extrinsic compression of the cord. They all are almost uh, the same thing, the tubercular abscess, the caseous tissue due to the necrosis of the tubercular infection, granulation tissue and pus, and inflammatory edema. The mechanical causes of extrinsic compression of the cord are tubercular debris again, the sequestra, the canal stenosis, the internal gibbous, pathological dislocation of the spine. Now we'll see the intrinsic pathology in cord. They are divided into vascular, degenerative, and atypical causes. In vascular cause, the thrombosis or end arteritis of the spinal vessels can cause the intrinsic pathology in cord. In degenerative, the myelitis, the syringomyelic changes, and cord stretching due to severe deformity can cause in paraparesis, and in atypical causes, spinal tumor syndrome can cause the paraplegia in Pott's spine patient. Order of neurological involvement. So this is the spinal. This is the diagram of spinal cord. The motor tracts are anterior and lateral. The sensory, the anterolateral sensory pathway is located here, and the posterior sensory tracts, that is for fine touch, vibration, and proprioception, is present in the posterior part of the spinal cord. So motor system involves first, then sensory. So this is the sequence in motor. If the motor tracts gets compressed, the first sign is ankle clonus followed by the plantar extensor. Then mild spastic motor weakness, and that is characterized by the clumsiness and incoordination of gait. And then we see the severe weakness, and if it progresses, then it lands the patient into the bed. So when we will see the stages of the paraplegia in tuberculosis of spine, so this sequence actually helps us to understand that stage-wise classification. So in sensory, the sensation carried by the lateral spinothalamic tract followed by posterior tract. So pain, root touch, temperature will be affected first, then vibration and proprioception. So lastly, there is a paralysis of anal sphincter and bladder. So in extreme cases, spasticity disappears and paralysis becomes flaccid. So now we will see the stages of tubercular paraplegia. So in stage 1, The patient is unaware of the neural deficit. Physician detects the plantar extensor and clonus. जैसे कि हमने अभी देखा था कि सबसे पहले मोटर में जब मोटर ट्रैक्ट कंप्रेस होता है तो सबसे पहले एंकल क्लोनस और प्लांटर एक्सटेंसर साइन हमें मिलते हैं. सो तो स्टेज 1 में द पेशेंट इज अनअवेयर ऑफ द न्यूरल डिफिसिट and physician detects the plantar extensor and clonus. In stage 2 patient is aware of the deficit and again जैसा हमने देखा था कि उसके बाद मसल in coordination of gait होता है. तो patient with complaint of clumsiness or in coordination while walking but manages to walk with or without support. And in third non-ambulatory patient motor जो ट्रैक्ट कंप्रेशन है वो और सीवियर हो गया. तो हम इन कोऑर्डिनेशन ऑफ गेट के बाद बेड रिडन और अभी हमने जो देखा था कि पेशेंट बेड रिडन हो जाता है. सो नॉन एम्बुलेटरी पेशेंट हमें मिलेगा स्टेज 3 में विद पैराप्लेजिया इन एक्सटेंशन एंड सेंसरी. और सबसे पहले जो देखा था हमने कि मोटर पहले अफेक्टेड होता है देन मोटर पहले अफेक्ट होता है देन सेंसरी इफेक्ट होता है. तो मोटर के बाद सेंसरी लॉस होगा एंड that is less than 50%. And in stage 4, stage 3 plus flexor spasm, paraplegia and flexion और फ्लैसिड पैराप्लीजिया भी मिल सकता है. जैसे हमने देखा था कि एंड स्टेज जो स्पाज्म है वो डिसअपियर हो जाता है एंड फ्लैसिड पैराप्लीजिया आ जाता है एंड सेंसरी लॉस मोर देन 50% एंड और ब्लैडर बाउल इन्वॉल्वमेंट. And classification of paraplegia in TB spine, that is Griffith classification. It is divided into early onset paraplegia or late onset paraplegia. If the paraplegia occurs within 2 years of onset of TB spine, it is early onset paraplegia. And mostly it is due to the inflammatory edema, calcium tissue, abscess, caseous tissue, and ischemic lesion of the cord. And in late onset paraplegia, that is after 2 years of the persistence of the disease, mostly this is due to the caseous tissue, tubercular debris, sequestra, internal gibbous, canal stenosis, and severe kyphotic deformity. तो इस पार्ट पे हमने साइन सिम्टम्स को डिस्कस किया एंड नेक्स्ट पार्ट ऑफ द पॉट स्पाइन we will discuss the diagnosis and treatment part. So thank you.